Hey, welcome back, everybody. We're back with our sponsor, Dr. Rhys Branman of the Cosmetic Surgery Center. He's here to talk about gynecomastia and male breast reduction. And good morning to you, Dr. Branman.
Good morning.
Thanks for being here.
Well, thanks for having me.
This is something that gynecomastia, obviously male breast reduction after that kind of explains it a little bit, but gynecomastia is a problem that I don't think people realize is more prevalent out there.
And people don't talk about it.
Yeah, exactly.
Which is really amazing. You know, 50 to 60% of grown men have gynecomastia.
Really?
Really. And
over half.
Over half.
Wow.
And it can be very embarrassing because let's say you want to go to the beach.
Yeah.
Or you want to go to
the
lake.
Pool.
To the pool.
Yeah, right.
And you don't feel comfortable taking your shirt off. That's really a problem for a lot of guys. And a lot of guys don't realize that they can take care of it very easily.
Really?
The other thing is that a lot of children, young adults, have gynecomastia as well.
Okay.
A lot of young males in their teens, and that can be very embarrassing and can really create some psychological problems for young men as well.
What is it caused by?
Well, if you think about it, there's a number of things that can happen. You can have hormonal imbalances.
Okay.
Some drugs do it. Hereditary. You could just have hereditary, and that could be a problem.
Like a kid, like you mentioned, a kid could be looking totally fit and playing sports and everything, but have that.
Have that.
Okay.
And in some cases, some drugs can cause it.
Really? Okay.
Yeah. Marijuana is a big one, so recreational use of marijuana can cause it.
Really?
As well as some other medications.
Okay. And you mentioned, it does span all ages. What's the most, I guess, the age group you see it the most in?
Typically, we see it in men in their 30s and 40s.
Okay.
Because eventually they get to the point where they say, hey, I'm sick of this. I don't want to have this anymore.
Yeah.
I can't wear my t-shirt outside. I mean, when I go outside, I'm embarrassed to go to the pool. And they say, hey, I want to take care of this.
You mentioned it's easily treatable, something that a lot of people don't realize that as well.
And that's the amazing part. People think they're going to have this giant scar on their chest.
Yeah.
And they don't have to have that because they can have a tiny little scar that sits off to the side, almost under the armpit. And we can do it through vaser liposuction, where we're actually heating up the tissue underneath, removing the fat, and then it causes a contraction of the skin tissue so that you don't end up with saggy skin.
That's the worry,
and
right?
That's
yes,
the key.
Exactly.
And so you don't get an embarrassing scar on the chest. You end up with a contraction or a tightening of the skin, and you get a better, more defined breast. And here's a great example of it. So here's a gentleman who had some fullness in the chest right here. And he's got these natural creases, and that's where those incisions go. Here he is after the liposuction, vaser liposuction. Look, there's no more fullness.
Yep.
You can't even see, if you look real carefully, here it is. There it is.
I couldn't. No,
you wouldn't even pick it up.
Pick it out. Yeah.
And this guy is thrilled. He can go out, he can play sports. Plus, we don't remove any fat up here, so it actually defines your pecs better. So if you want to work out and get a better shaped, more defined chest area for a guy, this is the way to do it.
And looking at those creases you mentioned underneath, look how even those went away.
Those went away. They're not red anymore because he's sweating under there. So it's, and here's another
The side view here,
here's a
really
side view.
Illustrate it.
Yeah, so you got this fullness right here.
Yeah, yeah.
Now look at it. And there's this incision. And that's probably about 6 to 8 weeks old. In about another 2 or 3 months, you're not going to even see it.
I have smaller scars or bigger scars on my body from a mole removal than
That's
that.
right.
Okay.
Yeah, it actually looks like a mole removal.
Yeah.
And so this guy is going to enjoy his summer. He's going to enjoy working out now because he can actually define the muscle and really show his workout
underneath, right?
That's right.
Yes, and that's what you want to show off, of course.
Absolutely.
Now, when we're talking about the procedure, what kind of time are we looking at here in terms of how long it takes to perform it? How long is the recovery typically?
Sure. Performing the procedure is easy. It's done under general anesthesia, so you're completely asleep. It takes about an hour and a half to do the procedure itself. Okay. Afterwards, you're going to wear a compression vest underneath your clothes so you can actually hide it very well.
Okay.
You wear that for about 6 weeks, and then you're done.
That's it.
That's it.
And then you look fresh and ready to go.
Years of feeling embarrassed are gone. You can go out to enjoy life.
And what a perfect time to take care of this now before that season starts, right?
And then if you get it now, you're ready for summer.
I was about to say, you're ready for spring. You're ready for all the fun that's going to happen later on when now no one's going to be showing off that kind of chest when it's 30 degrees outside. For folks, you can get it taken right now.
Unless you're doing a polar plunge.
Polar plunge, okay, that's the one thing. And even then, you should wear some type of shirt or something like that out there. Hey, if you want to get this procedure taken care of, or really any other procedure out there, folks, to look good before those swimsuit seasons really start, go see Dr. Branman and all the fine folks over there at the Cosmetic Surgery Center.
We have a special, too.
Really?
$1,000 off our surgical fees.
Oh, really?
You can't beat that.
You cannot, especially right now.
No.
Dr. Branman, thank you so much for coming in this
morning.
morning.
Thanks, Chris. I appreciate it.
All right, we'll see you next time. Coming up next after the break, we're talking about true skincare crimes.